Good afternoon, everyone. Thank you for joining us today for our weekly discussion on COVID-19. This week is especially important because today Arlington, along with the rest of Northern Virginia, is entering phase 1 of the governor's Forward Virginia plan. I'm Katie Crystal, a member of the county board. I'm so glad to be joined by my teammate, Matt DeFerranti. And we also have several members of our county's leadership team with us today. We have Deputy County Manager Jim Schwartz and County Manager Mark Schwartz joining shortly, Dr. Aaron Miller, the Director of Emergency Management for the county, and Economic Development Director Tully Tucker. Thank you all so much for joining us. As most of you know, when the governor first announced his plan for advancing into phase 1 earlier this month, Arlington, along with our Northern Virginia neighbors, asked for a delay. Our 13 localities here in Northern Virginia, with an estimated combined population of 2.5 million, produce 40% of the state's gross GDP. And we've been behaving differently or experiencing COVID-19 differently than the rest of the state. So our mayors and board chairs across the region have been meeting regularly and have importantly been informed by our public health directors on the data and the measures needed to keep our community safe. On May 24th, 5 days ago, our public health directors conducted a new assessment indicating that our region has met 4 of the critical metrics. They've also assessed the need for a continued focus on expanding our contact tracing capacity and developing sustainable supplies of personal protective equipment, or PPE. Following this assessment, elected officials, including us in Arlington, across Northern Virginia, joined together to indicate our desire to move forward to phase 1 with the rest of the Commonwealth, beginning today. So today we'll be talking a lot about what the specifics of phase 1 mean for residents and businesses in Arlington. Before we get into those questions, let me turn it to Matt to share some highlights from the week.
Thank you, Katie. It certainly has been a very busy 4-day week. Before that, last weekend, we opened further our parks. We had trails open, but we opened our 148 parks. And I'm happy that residents will begin to be able to enjoy our green space even more while social distancing. We know that COVID-19 and the governor's necessary stay-at-home order have taken a tremendous toll on our community. The county has responded on many fronts. In addition to maintaining essential services, we provided an increased funding for emergency food and rental assistance. We reordered our fiscal 21 budget priorities to create a $10.2 million contingent fund to help broaden and strengthen our social safety net. And we created a grant fund for small businesses, among other actions, which we may talk about today. On Tuesday, we hosted a state-supported one-day testing site at Barcroft Sport and Fitness Center, where over 1,100 people received a COVID-19 test without a doctor's referral and without an appointment. We're exploring options for hosting more of these types of events. In the meantime, we are continuing to offer testing with a doctor's order at Virginia Hospital Center's Quincy Street location and the collaboration between the Virginia Hospital Center and Arlington Free Clinic at Arlington Mill. We're also seeing additional testing being offered by private entities for the first time at scale, including local drugstores. In addition to, the governor made a number of new announcements this week. First, we appreciate that the governor acknowledged that Northern Virginia's readiness to move into phase 1. He also issued a new executive order this week requiring face coverings, masks, while indoors in public settings, including businesses. We know there are a lot of questions on this new announcement, and we're eager to get to those questions of yours. The governor launched a new benefit for SNAP recipients, food stamps, that offers online shopping access available through the Walmart and Amazon platforms so far, and we hope more to come. This gives families additional flexibility to put food on the table without putting themselves at unnecessary risk. In phase 1, takeout and curbside pickup for restaurants and beverage services can continue. Now we will add outdoor seating that will be limited at 50% of the capacity of the restaurants and establishments. On Tuesday, the county board approved an administrative process to allow such areas called temporary outdoor seating areas. You may hear us refer to those as TOSA later in the program. Those are permitted to help restaurants reopen safely in outdoor space. We're also launching a special We Are Covered initiative so businesses and others can showcase their efforts to comply with the governor's mask order. The county manager has been working with his team to get our community ready for phase one. So let's get to some questions. As a reminder, you can submit comments in the Facebook chat. Participants can also text their questions to 571-348-3053. That's 571-348-3053. We'll do our best to get to as many questions as possible. Over to you, Katie, to start. Katie, I think you're on mute. Sorry.
Seems to happen to the best of us, doesn't it?
Yeah, sure does.
Thanks, Matt. So I mentioned at the top of our conversation that the Northern Virginia Public Health Directors had done an update about 5 days ago of the key metrics for entering phase one. So I'm going to turn it to Erin Miller, our Emergency Management Director, to share a little more about what that means. What are those metrics and how is Northern Virginia performing against them?
Sure. Thank you, Katie, and good afternoon, everybody. You're correct that about 5 days ago, the Northern Virginia Health Directors conducted a new assessment indicating that the region had met 4 of the 6 critical metrics, and that was increased testing, a downward trend in the percentage of positive cases, or what we call the positivity rate, and hospitalizations, and that enough hospital beds and intensive care capacity was available within the Northern Virginia region. The 2 metrics that were not met, but they continued to show promise, were expanding the contact tracing capacity. And so there are some jurisdictions, not only within Northern Virginia, but also across the Commonwealth, that are looking to continue expanding their ability to contact trace. And then the final one was developing sustainable supplies of personal protective equipment. And the health directors focus not just on the supply for hospitals and for our first responders, which they believe was a very solid supply. Based upon our current capacity, for instance, with Arlington, we're comfortable in the fact that cases could double and we would still have enough personal protective equipment for our hospitals and our first responders. But what the health directors focused on was the PPE availability for private doctors' offices and other what was considered sort of non-essential healthcare services. So for instance, routine visits to your dentist office, right? Routine visits to other healthcare practitioners for just sort of normal levels of care. And they focused on the fact that many private doctors' offices and many of those physician groups still have trouble accessing appropriate supply chains for some of that personal protective equipment. And so the health directors mentioned sort of the need for the state to continue to support that through their medical societies and through the Virginia Department of Health and through other avenues.
Thanks for sharing that answer. And it's really important. And I think, too, when we talk about the need for comprehensive testing, this is a big piece of it. When you get tested for strep throat, for example, you don't do that at a big one-day testing site at Barcroft. You go to your primary care provider. And until we have the ability to fully support our primary care providers in personal protective equipment, we're going to have a hard time reaching that mature state of testing. Okay, so with regard to phase one, let me ask a high-level question, and then we're going to go to some viewer questions. So I'm going to ask Jim Schwartz, if you wouldn't mind, perhaps joined by Tully Tucker, our Economic Development Director, to talk a little bit about what transitioning to phase one means for our residents and businesses, and in particular, what it means for our restaurants.
Yeah, I'll start, Katie. Thanks for that question, and then I'll let Telly drill down with some more detail there. So the phase one that the governor has announced does start to open us up in a number of areas. Restaurants are allowed to operate as they have been with curbside delivery and takeout delivery, and they can start to open on their physical presence, but they must do it outdoors and they must do it at 50% of their approved occupancy capacity. So there is an opportunity for people to get out of their houses, they're out of their homes, and begin to dine elsewhere, but it's still going to be restricted for a period of time. As far as other retail establishments, brick and mortar kinds of establishments, as called out in the governor's order, those too can begin to open. And in doing so, they also are restricted to 50% of their approved occupancy load, typically something that is done on the certificate of occupancy. They will be limited to 50% of that. And then, of course, as has been mentioned already, the governor has also put a requirement that when people are in those kinds of settings, they must have masks on. Any indoor, any public activities indoors must include face coverings or masks. Telly, anything you want to add to that?
Sure. Thank you, Jim. I would say we've covered a lot of it. We talked about the parks opening earlier. Mr. DeFerranti mentioned, you mentioned the restaurants. I think I would add gym and fitness centers can offer limited outdoor exercise options only at this time. Outdoor swimming pools may be open for lap swimming only with one person per lane, and additional restrictions. Beauty and nail salons are many of our personal service groomers, barbershops, and the like. They can provide services by appointment only, but they also must follow strict guidelines. And additionally, I'll mention places of worship can be open for drive-in services or services inside at 50% capacity with social distancing requirements in place. And I'll echo Jim Schwartz's comments about masks, the requirement for masks in Executive Order 63 by our governor. We certainly don't want to diminish the importance of continuing to practice, all of our other health protocols with regard to social distancing and washing hands and making sure we're maintaining our distances. But additionally, the mask coverings is a requirement that we're asking everyone to abide by as well. And there'll be more information coming out actually today on the release of how we get businesses, many of our multifamily facilities, apartment buildings and the like, all under the We Are Covered brand, which more information will be coming out momentarily about. So I think I'm happy to expand on any of those, but for now I'll pause there.
Thanks, Telly. And I'm so glad to see that we've been joined by our Public Health Director, Dr. Ruben Farghese. Thank you for joining us. Get ready. I'm going to come to you next with a question about the results from that Barcroft testing site. But first, let me go over to Matt to take our first viewer texter question.
Thanks, Katie. So one of our questions is about the results in zip codes. And so the question is, most of the cases are coming from a single zip code and ethnic group. One testing event is not sufficient. How can Arlington aggressively increase engagement, testing, and mitigation with the impacted community? I think maybe this is a question that multiples of us could talk a little bit about. I'll just start, and then Ruben, if you can add in, but I'll start by saying very much our desire is to focus testing on where there have been the most cases. We're mindful that we need more testing as a whole, but Barcroft was the preferred location, in part because it's a facility where this could work, but also because the most cases were closest to that facility. So Ruben, do you want to add anything on testing and engagement or work with the community at all on this question?
Sure, thank you. One of the focuses that I hope people will remember is, as we try to focus on the pandemic and how to get it to exit this community and the region, we would really like to focus on the areas of hotspots. And so efforts by the state to provide this sort of testing are welcome. And it's a shared resource. So a number of us did it all at once, and we're now regrouping to see are there more ability to conduct these things and still focus in the areas with the hotspots, because I think I want to make sure people realize where there's infection and or germs, and we've seen a higher amount. We want to focus on those areas to find ways to identify people who are ill or who have the germ, and then get them into isolation so that they don't actually spread the germ to other people. That's the beauty of the testing in many ways. And so it's why we actually established the site at Arlington Mill as well, so that more people in those communities where we know that there's been a more difficult time, honoring the governor's stay-at-home order, because they're essential workers and they can't actually stay at home we want to make sure that each time they're out of the house where they can pick up germs, that we can identify them faster if they become ill or if they're asymptomatic. So that's the focus for public health in the region as well as the state. And so I wish I could promise more sites more quickly, but we're trying to do our best with limited resources and taking the state resources and figuring out where to best put them.
Great, thank you, Ruben. And I'll just sort of put a fine point on it and say that we are pushing for more tests. Absolutely, that's work. Chair Garvey and as a region, we're asking for more tests, and we think it's important. And so that's kind of the background to that question, at least as a start. Keep in mind there were tests across the region Ruben was mentioning. We want more, of course, for Arlington, but we also know that we're part of this Northern Virginia region. So back to you, Katie.
Yeah, so I'd love to actually drill in a little bit to the data resulting from that free testing event. I think you all talked about why it's so important to be able to have those testing events in the communities that are hardest hit, in particular focus on those who may be uninsured or underinsured. And so I wonder if either Ruben, you could talk to us, or perhaps Aaron could join you in sharing what we learned. What were the results from that 22204 testing at Barcroft? Do we know whether we reached the intended population, which is to say residents of our hard-hit neighborhoods in 22204? And what are the percent positive? I'm going to tack one other question, which is that we have a follow-up from on the Facebook chat, which is what's the percent positive in Arlington overall? Do we know?
Sure. Okay, I'll be happy to start there. We actually had 1,162 people actually go through the testing site that day. We had originally planned for 1,000, so we were fortunate that it was working so well that we could get a few more in. And not unlike other jurisdictions that have done it, 63% of the people participating were actually from Arlington. The next 30% were actually from other jurisdictions in Northern Virginia, and they had similar results for us as well throughout either Alexandria, Prince William, Loudoun, or Fairfax. So glad that people were able to get to what they needed. And so the vast majority were either Arlingtonians or Northern Virginians getting that. And the good news was that based on the zip codes, we actually were able to, the 22204 zip code, where this event would occur, actually it was 60% of the Arlington residents. So I think that was a very successful thing to be able to have it there so that people could actually walk. And Aaron, you may want to talk about the throughput that day, like walk-ups versus cars, because that may give an indication of why that was successful.
Yeah, absolutely. So one of the things that we know is that there are many barriers, not only to getting the test, but it's also being able to get to where that test is available. And so our commitment in order to do that was to make the Barcroft testing event, like we've done with Arlington Mill, accessible for all of our residents who may not have a vehicle or rely on public transit or other modalities of getting to and from where they need to. And so we had a very great showing with walk-ups. And I think, the walk-up folks that we had, the data shows that they were from that neighborhood and that we were sort of being able to meet the demand and meet our residents where they are. And so, our commitment is to continue that and to continue to be able to provide those ways that we can make it more accessible.
Thanks. Matt, you want to go to the next round of questions?
Sure. There are a couple of questions about dog parks, and just want to make sure we touch on those. So when will they open, and will there be supervision to keep the number of people down in the dog parks? Our Department of Parks and Recreation is working through that, but I see, we've seen some emails about that already in the last 24 to 36 hours, but I don't know, Mark Schwartz, if this is one that you want to touch on at all. Since you've shown up, we get to kick questions to you. So,
thank you, Matt. On dog parks, we're going to take a close look. In reference to the correspondence we've received, there are some difficult circumstances. It's hard enough when you are just dealing with all people, but when you have dogs and sort of the way people have to, we require people to monitor what's going on. I'm not going to commit right now to a date when we're going to do it, but I will tell you when we figure it out, it's likely to be the very last thing that we open up, even after playgrounds. But we will be making an announcement in the middle of next week about the next phase of park openings. On probably Wednesday of next week, we'll come out with an announcement. So we'll include more details then.
Great, thanks, Mark. Beneath that is the question of just Shirlington Dog Park. There's the opportunity to properly social distance there is part of the concern that I think we're working through. So back over to you, Katie.
Great. So I think, as anticipated, the big question of the day is about this mask order and how we'll enforce it and who enforces it and what are the exemptions and where can people report concerns. This is a whole bucket of questions, and I know it's something we've been thinking about a lot in Arlington, both trying to distribute masks, but also to work with our businesses and nonprofits to help ensure the masks are reaching those who most need them. Of course, the continued community conversation is really about enforcement. Who's required, when. Good sub-question here about if you have a health condition that is an exception for the mask, do you need a doctor's note to do that? So let me turn it to both the Schwartzes. We have Mark and Jim. Aaron may be able to chime in too about this question of how do masks get enforced, who enforces them, and also how we're distributing masks.
So I'll start with the enforcement piece, and it's going to sound fairly similar to what I've said the last few town halls, which is that right now the governor's order extends to people who are indoors at businesses. And also there are some specific circumstances, for example, the servers at restaurants. What we're going to encourage is voluntary compliance up front. People should, know what's going on. We're working with our businesses and our multifamily apartment owners for a program calling We're Covered, which essentially would be an agreement by those businesses to have masks on hand and on their own require those people who come into their businesses to wear those masks. And if people don't have them, give them to them. Now, if there are instances where people are coming in and they're not complying with that, they can be asked to leave. It's a little bit uncertain because the state has been a little bit unclear on this, but they've said the public health director in each of the localities would be responsible for enforcement. I'd like to state for the record right now, I'm not sending Ruben out to every business in the county to wave his finger. So what we will do in that particular case, if there are repeated instances, we're just going to encourage people to call the COVID number 7999 with questions. And if worse comes to worse, we will end up enforcing it, but that is a last resort. So I'll send it over to, I think probably Aaron can speak a little bit about the mask distribution process we have.
Sure, thanks. And I see this comment already popping up. That is 703-228-7999. That is the county's COVID-19 hotline where we attempt to centralize all resources and answer as many questions as we can for you. We understand, and I said this last week, that a number of our residents may not have access or the means to get a cloth face covering. And we know that, despite the fact that you can use a bunch of readily available materials, whether that is a bandana, whether that is an old t-shirt, and we have guides on how to do that, we know that there's still barriers. And so the county has procured a quantity of cloth face coverings. This morning, we sent out through a number of our channels a survey to community-based organizations. So those are our networks of providers that work with the county to serve our residents. And those organizations are going to respond to us with quantities that they would need in order to provide out to their clients, and we're going to work with them to get those cloth face coverings to those community-based organizations. And so depending upon the need, we know that we may have to order some more, but we're looking forward to be able to provide that in the county.
Excellent. Thank you very much. We'll keep an eye on the text line in the chat in case there are any more specific questions about masks or enforcement that haven't yet been touched on. But for now, Matt, back over to you.
We're getting some, we often do, but we're getting questions again about contact tracing, and that was one of the six, one of the metrics. So the question probably is for you, Ruben. It's what's the plan to scale up our contact tracing capacity, and is there anything that residents can do? There's a note about this, specifically thinking about the app developed by Apple and Google, and that, as far as I know, you may have more background on that, but it's what can folks do to stay informed? I'll start with that and then send it to you, Ruben. If you're not receiving our email updates, our COVID-19 alerts via email, then please go to Arlington's COVID-19 website and look for the place to put in your email and receive those alerts. It's really, really important. And then on contact tracing, I think Ruben and maybe Mark. Go ahead, Ruben.
Sure. It's a great question. The region as a whole is working with the Virginia Department of Health, and in our case, also our locality, to be able to increase our ability to scale up or down with contact tracing. So people have signed up through the Medical Reserve Corps. We're using county staff from public health, and our manager has supported reallocating staff within the county, those who are able to actually be part of that. We're perfectly comfortable having overstrength, having more people identified and trained so that, God forbid, it does go back up, we have the ability to interview cases and then actually talk to the contacts, to close contacts, to be able to do the contact tracing that's necessary. So very grateful for the support from the county and the community on these events. And I want to make sure people realize that contact tracing is not the only thing that's going to be helping to contain this virus. People cooperating with isolation, those cooperating with quarantine, and then people going out wearing those masks, the cloth face covering, so that they're protecting other people and not having the germs come out of their mouth in their close interactions. So it's a layered approach to improving and getting rid of this virus. So contact tracing is important, and it's not the only thing. A lot of it is literally in your hands. Wash your hands, cover your coughs, and stay home when you're ill. I had to get that in.
Sure. Mark, did you want to add anything on that? Or okay, great. So that's background. I mean, contact tracing will help. It's not the only thing. Is a really good message. Over to you, Katie.
Great. So I have some questions about phase 2, but I'm also seeing a good one, a really topical and timely one actually coming in that I think I can answer quickly myself, which is, what is our message to residents about calling the police to report non-enforcement? This is definitely at the top of our minds because we've seen some national examples recently of the way that calling the police can sometimes perpetuate dangers or racial stereotyping. And so I think it's really important that we want to encourage people to use our online reporting tools that were described during the mask enforcement. And I believe soon, if not yet, we're going to be encouraging people to call that 7999 number, the 202-228-7999 number, if you want to follow up on concerns about folks not following mask enforcement. That's not a great reason to call 911. We have other tools that we're encouraging people to use to report. We ask for your help in helping distribute masks to people who are not wearing them. There we go. That website's up right now, rather than calling ACPD directly to report a lack of mask wearing. Okay, so lots of questions actually about phase 2. People are already looking ahead. We enter phase 1 today. What's next? I wonder if this might be a question for Ruben and Aaron. If you could talk a little bit about what are the metrics that we'd be looking at to enter phase 2, and how Northern Virginia is thinking about this. We know the rest of the state is going to be entering phase 2 relatively soon. So how would we be thinking about measuring our metrics, making sure we don't move ahead too quickly before we can get good data about how we're doing?
I'll be happy to start, and Aaron, you can jump in afterwards. I think people are expecting a different set of metrics for phase 2, and for me, the metrics that were actually promulgated by the governor back on April 24th, the ones that the health directors have been looking at in Northern Virginia would form the basis for that. So once again, looking to see that there's continued decrease in the percent positivity over 14 days, seeing hospitalizations continue to decline over 14 days related to COVID. One of the things that people are going to be probably unhappy to hear is we can look at metrics. The decisions about going forward are going to be made by the governor, and I'm hoping that we will have more latitude if we need to, and not just go directly into phase 2 after a week if that's not appropriate. But that is, I'm going to say, above my pay grade.
Appreciate that. So we'll definitely, I think we've learned in the past that the best way we can make our voices heard is to stay in close collaboration with our regional colleagues. I'm certain we will be doing that regarding phase 2 as well. Matt, back to you with questions.
Got it. So we've had quite a couple of questions actually about infections within a household and whether people can access, if someone in your family is tested positive, whether we can access resources. And that's a challenging thing to do. I don't know, we have some resources for those who test positive in our homeless shelters. We have worked with hotels, but it's to do that in every case for 235,000 people is a challenge. I don't know, Ruben, if you want to touch on that a little bit.
Sure.
I do think to some degree, if you have a question on this, you should call one of our numbers and follow up to get the specifics. But Ruben, go ahead.
Sure. It's a great question. One of the things that people may not be aware of is that as we talk to the cases, we also evaluate their basic needs. We're not trying to do long-term needs, but we're trying to do the short-term things. Things like if they don't have a thermometer at home and we have a supply, we will drop off a thermometer so that the individual can use that in their course of their care. If they haven't had access to food, or they're worried about it, connecting it to the resources we've already set up with AFAC and others, and there have been food deliveries so that they don't have to leave their home. That is for, of course, the people who don't have like the buddies and are not as well connected in our community. Fortunately, most people have not needed those services, and we encourage people to make plans. It's actually one of the reasons why we put out that circular or that flyer that we sent out to all homes, and actually asked people to create a buddy system as well. The time to make a friend is before you need one. Start finding out which other family you may be partnering with to help you as well as you can help them, that should you become ill, there's someone who can actually help you get the supplies, the groceries that you need. You don't need a lot of things because you really just need to rest and recover and drink fluids. I know there are people who are worried about things like paying the rent. That's why some of the things were put out, and I'm probably going beyond my knowledge of this, but that's where, the prevention against eviction and other things, those notices went out. And so things are in place together. And that's why, please, I hope people kept this. This was mailed to every single household. Put it on your refrigerators in English and Spanish, and it's on the website in 4 additional languages as well as the English and Spanish. So if you don't have it, please go on the web to find it. It really does tell you how you can take care of yourself if you should unfortunately develop COVID.
Great, thank you, Ruben. The website really is a huge, huge resource. I'll just say that number for if you have questions, you could also try 703-228-7999. But it's all, getting a buddy is key, and it's also about seeing if we can take care of our neighbors and ourselves. And that's part of why we're describing we're covered, and part of the responsibility on masks that we're all working on. But over to you, Katie.
Great. So another good question about a vulnerable population in our community from Alexa. What about long-term care facilities? What efforts are underway there? I know we've talked about it in the past, but is there anything new to share? And is there any new data to share about the metrics that maybe are being tracked in those long-term care facilities in particular?
Sure, happy to address that. So I don't think it comes as a surprise across the nation, in the region, and even in Arlington. The residents of long-term care facilities, of course, are going to be more at risk if the germs get into the community, into their small communities. And so there's been a lot of focus from the county. The Public Health Division obviously works on communicable disease control and prevention guidance with the long-term care facilities routinely. It is something we routinely do. So we've built on that, and in partnership with our Aging and Disability Services Division, we're in close contact with the facilities essentially daily. Any of the facilities that actually have any outbreaks associated with it are managed by, there's one nurse assigned to each facility to be able to assess their progress. This is a complicated problem. I wish it was an easy solution. Number of these facilities don't have as much staff as I would like, but that was not something that was created during COVID. That's the situation as we as society have allowed or found acceptable. And so some of the things that we talked about with the testing in 22204, for example, there's a confluence. You've got individuals who are low-income earners who actually are essential workers of these places, and they sometimes work between several facilities. So we've had to encourage people, to see if they can provide higher wages, keep people working at one facility, and then trying to remind people of the connection between the two. We've got individuals who are living at home who may bring things into facilities or bring them back, and there could be a cycle. It's why we're focusing on both aspects, trying to target the areas that are hotspots and also help the facilities with helping improve infection control. So some of the things we've done after we gave the guidance, we're sending in staff. There's some risk. They're actually going in to observe what infection control practices are happening at the places with the outbreaks to see if we can improve their practices. The facilities are willing, but they will need to think about how they invest resources. And one of the things we've also talked about on a policy level with legislators is how to change this going forward. So it's a complicated problem. Good people are working on it. And I wish I could say there was a simple solution, but one of the best solutions will be for us to get this virus out of our general community, which means it will then stop entering the facilities as well.
Thanks, Ruben, and thank you to your team, which I know has been really focused on our vulnerable populations and the workers who are being exposed in these centers, and particularly helping them take those really critical infection control steps that you described. Matt, over to you for the next question.
Got it. Thank you. So there's a specific question that it's about multifamily dwelling spaces, multi-unit buildings, and is the common space in a multi-unit building considered public indoor space, and do you have to wear a mask there? And so in answer to this person says they live in 22204, and they're concerned that almost no one that they see is wearing a mask in the buildings. This really goes to what Mark Schwartz mentioned a little bit earlier. You should be wearing a mask in the common spaces in your multi-unit buildings. But the governor's order is new, and it's just taking effect. And we also know that requiring and compelling enforcement in those multi-unit spaces is not going to be possible. So we want you to encourage people, and we want you to, there also is a way to say, under the We're Covered new effort that we're working on, you can sign up as a building to be covered for making sure that people are wearing masks. That's sort of how I'd start. Bryna we've just put up this website, and if you see a problem, as Katie indicated earlier, don't call 911, but go to our website, and there's a place where you can register that we need to make sure that buildings are all complying. I think that summarizes it. Ruben or Mark Schwartz, are there any corrections that you'd have to how I tried to address that?
Actually, the one thing I wanted to point out, I thought it was correct. I just want to make sure that people realize it's not just high-rise buildings in 22204. I know that's not what you intended, but I don't want any viewers to suddenly go, oh, it's fine elsewhere. This virus can be transmitted asymptomatically. And so there's community spread throughout Arlington and the region. So we are still saying everyone is possibly at risk for actually transmitting the germ, which is why wearing these face coverings in public spaces is something that I think is our duty as residents of Arlington to protect each other and the region to accomplish. It's why I wear it. I spent time at the courts today to help them understand things, and we were all wearing masks in these public spaces that entire time. It's not easy, and it's what we need to do to help corral and end this pandemic.
Wow, really well said. Thank you, Ruben. Over to Katie.
I just want to take a second and linger on that last point. Ruben, that's exactly right. We can spend so much time talking about enforcement and the mechanisms for reporting and the distribution of masks that we can sometimes lose the most key message, which is that every one of us has an obligation to protect our vulnerable community members and everyone around us and help stop the spread by wearing a mask. I know it isn't comfortable. My family and I were out walking around Teddy Roosevelt Island last weekend. It was a little hot, a little sticky behind that mask, but I know that it's what I can do to protect everybody else and make sure that we don't have to move backwards, that our gradual reopening can continue. So please don't forget about the role of personal responsibility. And we really encourage you and all of your family members and loved ones to be taking the individual responsibility and choice to wear a mask. So a couple of good questions throughout, maybe 3 or 4 actually, about schools, public schools, and when they will reopen. Just want to reference a couple of resources. I know that our team has posted in the chat on Facebook Arlington Public Schools planning scenarios, their framework, considering 3 different potential realities come fall. One would be starting the school year with distance learning, if that's what public officials advise. The other would be reopening schools with a hybrid of in-person and online instruction. And the third would be reopening schools completely as normal. Schools is anticipating right now, the third is the least likely scenario. But if you follow that link, you can see a few more details about what each of the first 2 might look like. We got a great question on Facebook at the beginning of our chat, referencing the very true reality for many families, which is that if distance learning is continuing, either completely or in a hybrid model, it is going to be essential for our students to have quality internet connection, to be connected to their teachers and their peers, to do their homework online. And that's something we've been working on pretty hard at the county level in partnership with Arlington Public Schools, of trying to bridge that digital divide and make sure that all of our students who need the internet have the internet to keep up and not fall behind in their schoolwork. So I'd love to ask, I think actually Mark Schwartz might be the right person to talk a little bit about this. The new program we've just adopted to bring internet to families that need them across the county, or need it across the county.
Thank you, Katie. And absolutely an important point, which is that if distance learning is going to work, everybody needs to have a reliable and certain connection that they can use through the internet. So the county board, I think at this point, it's probably a week and a half ago, though again, I've lost all track of time, did approve $500,000 allocation from the Federal CARES Act money that will be provided to work with Arlington Public Schools as grant funds for those individuals who do not have internet access. The Comcast Essentials program is going to be the main point for that, and people should get in contact with Arlington Public Schools. Their Department of Technology over there is working to sign the contract with Comcast, receive applications, and there is very little, we checked, very little in the way of backlog as far as installation. A lot of it can be done with self-installation, and I encourage anybody, and ironically, I think a lot of the people who we're trying to encourage clearly won't be listening to this because they won't have that internet connection. But if you are aware of people, make sure they find out that information. You can go onto our website and type in, I think you'd have to go in and you'd have to type in digital divide, and it would pull up all the information. And also Arlington Public Schools will have that information. So, and I also would refer you all to the thoughtful comments of Ms. Katie Crystal that were quoted in the Washington Post 2 days ago, where there was a lot more detail on this article, also quite quoting from public school officials.
Thanks, Mark. All right, Matt, what's next?
A couple of quick hitter questions about specific locations and whether masks can be required and whether we can open. So on trails, the governor's order, forcing everyone who goes on our trails and who exercises to wear a mask is not something that our police are going to be able to enforce. It's also covered by the governor's order as an exception for you can go outside for that purpose. So that part of masks, we can't force, we can't encourage. You must be careful when you're on trails. High school tracks, there's high school tracks, there's pools. Those, whether they can be open, those are questions that our staff is working on. We ask that you think about safety as we know you want to get out and exercise. So those are a couple of quick hitters. The question I'll just touch on is asymptomatic testing, and a couple of questions on the daily counts, which have gone from 5 up to 45. And I think maybe this is really an opportunity, Ruben, for you to kind of touch on. We would love to have more testing for everyone who's asymptomatic, and we would love to know with precision that those daily counts reflect everything. But maybe you can touch on the big picture where we are with there's community spread a little bit one more time.
Sure. So one of the questions I think people are wondering, how do we know, or how do I keep saying there's community spread going on? When you look at data like the hospitalization data for COVID, the number of cases we see, and see this across the region, that's really how we keep putting the data together, is the virus has not left and we're detecting it still. And asymptomatic is not the only way we're detecting it. When you see cases in the hospital and the beds are still occupied, yes, it's going down, but that doesn't mean the virus is gone. And so when I start seeing fewer and fewer hospitalizations, I can't tell you the specific number, but as we start seeing much fewer in the region, we'll start saying, okay, it's getting harder to find people who actually require hospitalization. That's actually a good sign. It means that the volume in the community is now much less. And then, just like with any other outbreaks, as we start detecting in the tests fewer and fewer positives, we'll continue to test as testing capacity goes up. And if we identify the few cases, that's where the contact tracing becomes even more important. We're going to go, where did you possibly get exposed? So that if you remember, when we started with COVID, it started with travel-related cases. Then it was there local or outbreak or known exposures? For those who remember, there was a church in the DC area that was one of the first places that was associated. It's almost in reverse. We'll go from community-wide spread to local outbreaks where we can identify where things are happening, and eventually be travel-related or hopefully none. So that's kind of, it's a gestalt. I wish it was a more precise science. We have to look at these things, and that's how we do this routinely. So as long as we start seeing those things and continuing to go down, we can say we're getting out of the pandemic, but I will say we're only out of it when we have 0 cases here. And I forgot the second part of that question. And I apologize.
No, I think that's fine.
Okay.
Touched on it. Just the big picture is that, we have seen the testing at Barcroft was 1,000. There was 1,000 in Prince William at other times. We're seeing a little variability, and people should just know that Ruben and all of the team are looking at the rolling average and the trends, keeping in mind that precision on this, much as we want it, is really hard. We have to make judgments based on the data plus our assessment of the trends. So back to you, Katie.
Great. All right, I've got one for Telly, who's been with us this whole time. We've seen one question, one comment about the TOSAs, temporary outdoor seating areas, and in particular, the relationship of those outdoor seating areas to the sidewalk and pedestrian access. So Telly, I might go to you, although I know this is very much a partnership of economic development and the Department of Environmental Services transportation team. But how will the TOSAs be configured so that people still have sufficient pedestrian access to all of the areas of the community where they might be in use?
So certainly, I'm not the subject matter expert on this, as we've had it's been a team effort with CPHD, our Planning and Community Development Department, as well as AED, and they've done a fabulous job. However, what I would say is, for those restaurants who do have outdoor space that's privately owned, I think it will obviously lend itself to a much more natural boundary as to where they can set up. As far as those restaurants who are seeking permission to use public spaces such as sidewalks or we have to infringe upon the street where parking may be public right of way, I would encourage each one of them to make sure that they get their application in. And each one of those, from my understanding, is looked at on a case-by-case basis by the CPHD review team, so that they can assess, making sure that we still have adequate pedestrian access. And ultimately safety is what we want to provide. So we want to be sure that we provide adequate space for restaurant to use to share some of that public space. But we can't forget that we still have to have pedestrian access as one of our safety concerns.
And accessibility, right, is really important too, making sure that we're making use of whether they're curb cuts or ramps or something else, so that nobody who might be in a mobility assisted device or pushing a stroller or anything else has to step off of or make their way off of a curb. So I really appreciate the team's attention to that. It'll be an interesting experiment in making sure that these community goals of pedestrian access, social distancing, and supporting our small businesses in a safe manner are all in harmony. But I have faith that we've got some really good minds on this and to do it quickly. All right, Matt, what's next to you?
Got it. So a couple of questions about how folks can volunteer. And I just want to touch on those quickly, and I'll ask Ruben or Mark to correct me if I'm wrong, but there are two things. Volunteering to be a contact tracer. There is a website. If you go to the Virginia Department of Health's website, there's an orange button on the left side of the website where you can sign up for the Virginia Medical Reserve Corps, which is a way to help with contact tracing. So that's one way to volunteer. For teenagers who want to volunteer, because of summer camps, there's a resources Volunteer Arlington. And if you look, if you go to that site, you'll see opportunities. So those are very helpful. Two other quick questions, one on athletic fields and one on bathrooms at parks. Mark Schwartz, I think these are two things that fall into that. DPR is Department of Parks and Rec is working on it. Anything you want to touch on with respect to those two specifics?
And if I'm remembering it, I think it was about bathrooms, and was the other one about tracks? No,
this is actually athletic fields.
Oh, athletic fields, right. So the athletic fields, I'll put that into the category of baseball, diamond sports or soccer, those kinds of things. We will have more information on that in the middle of next week. We'll have an announcement on that. As I've said before, that is the next step in opening up our parks. There were a few issues that we need to work out around staffing and signage. And so stay tuned, because we'll have an announcement in the middle of next week. On bathrooms, I think that, Ruben may be better qualified than I am to answer this question, but I think that there are some real challenges about, keeping them clean and the confined spaces, and sort of it's a little bit more of a challenge for us. So I will pitch that over to Ruben, because he was on that phone call where we spent a long time talking about this.
So, no, I think, Mark, you've got it correct that part of the problem is in these spaces, the ability to keep them well maintained and cleaned becomes the issue. And we know everyone's concerned about touching surfaces and so on with germs, even though the transmission risk is lower than from what you get through the breathing. It's still a concern. It's actually one of the reasons why, if you look at most of the guidance from CDC and in the reopening guidance from Virginia and other places, like, for example, when some places will have churches reopen, they've been encouraging people, saying maybe your service is shorter and you encourage your parishioners to use the bathroom before coming to church so that you don't have to use it at the event. So it's an extra precaution so that people don't have the exposure risk, at least from a health perspective.
Great. Thanks, Ruben and Mark. Katie, over to you.
We have a question on the Facebook chat about testing for populations of Arlingtonians with intellectual developmental disabilities. I wondered if, again, Ruben, we're really not letting you catch your breath today, but I know that thinking about particularly individuals with developmental disabilities, IDD, or behavioral health needs in congregate care settings have been a huge priority for our human services team and for your public health team. So I wonder if you could speak to that at all, populations for individuals in populations of individuals with those needs are in congregate care settings.
So, no, it's a great question. The behavioral health care staff, the community services board staff, and the public health division have all been working with these congregate care living facilities. They've received similar guidance, and if there have been cases, then resources have been put to help them with testing. A number of them have worked with some local providers to get those things done. So there is attention being paid there. It's some of the same issues that happen at the long-term care facilities. You've got individuals who often will need help with activities of daily living, which that's the real reason why when you have caregivers having to come in close contact with the residents and vice versa, it's that you can't stop that sort of contact, and especially if there was asymptomatic transmission. Providing things like the personal protective equipment so that they can try to reduce those sorts of things, and helping them with infection control, all things that have been provided. That doesn't make it an easy thing, but we have tried to make it easier so that they don't have to go to a hospital for testing, and helping them identify resources to have people come in to do the testing if it was needed.
Thanks.
Great. So a couple of questions about the amount of time. I think we touched on the governor's hint with respect to phase 2. I don't know if it might be Ruben, it might be Mark. For my part, I do think that we're going to phase 2 suddenly is a concern. We're going to look at the data, and I don't think that, Ruben, I don't know that you're there yet to that decision, and I certainly don't think that the members of the board would be there yet for the sort of non-data piece of this decision making. But is that sort of hesitation without prejudging what will occur? Is that where you are on phase 2, Ruben?
I'll start, and Mark, you can. I'll wonder what you'll say. Okay. So I think we need to clarify for everyone in some ways. The public health folks, we're going to look at the data and we're going to make an assessment of where the data is. We are not going to ultimately say, unless we're asked, what would the recommendation be? We'll say that the assessments are going down, staying the same, or going up. Obviously, putting on a purely health hat, which is what I think most people expect me to do, is, all right, if I see trends worsening, I would be hesitant to reopen because it means more people are going to be interacting closer and closer, and that would not be a way to reduce germ transmission and having the trends come back down, rather they would go back up. So with that, that's the advice I think all my colleagues in health will be saying. What we know is that, of course, politically we also have to balance the life safety needs with the economic life safety needs. And that is something that is maybe outside of the scope of public health. But what I've told you all in the community is, whatever the decision is, whatever that right balance is, then public health, including here in Arlington, we will be prepared to then make the best recommendations on how to protect ourselves within whatever policy decision has been made. And just been very grateful that having the support of the county leadership, manager, and the board to be able to be data-driven more than date-driven, but not all of those things are in our regional or state control.
I did want to add something to that, which is a little bit of an insight as to how we think about when we move, for example, from phase 0 into phase 1. We had the benefit of 20 plus pages of guidance from the governor about how to handle a series of issues that might come up. Even with that 20 plus pages of guidance and essentially another week of experience elsewhere in the Commonwealth, we still had a lot of work to do, even if the metrics were met, to move from phase 0 into phase 1. Reason why I bring that up is there is no guidance whatsoever about, even if metrics have been met, what phase 2 would look like and the kinds of issues we'd have to handle. I imagine they'll be even more complex than moving from phase 0 into phase 1. So this is one of those situations where I'm going to sound bureaucratic, but even if the health metrics make it, for me, there's this whole question of how do we set up, some common understanding and rules and programs that'll make sense. And I understand people are impatient on that, but it isn't easy. So certainly the governor did hint at it. When the governor does more than hint and offers some more substantial guidance, that'll make it easier for us to get to the point where we can talk about that.
Great. It's a hard question to ask, but we did get 2 or 3 questions about it. And I think we all are wanting to sort of align with the thoughtful hesitation that both Ruben, you, and Mark kind of expressed. Let's focus on getting we're covered and getting masks on and social distancing and phase one right now, and then we'll take it after that. But Katie, over to you.
Great. All right. So as we head into wrapping up, I think we have a great question as many of us are looking into the weekend and maybe hoping for a break from cooking. This is, Telly, maybe a question for you from one of our residents who asks, it's great that the TOSAs are happening for those who are interested in availing themselves, but for people who may be at particular risk for COVID-19 or who, like my family, just want to reduce any exposure we might be putting on others, are restaurants still going to keep offering pickup and takeout options? I don't know that that's mandated, but Tilly, you might have something to share with us based just on what your team's hearing from restaurants and whether they're planning to still do that.
Sure, and it is a great question. I do think it's responsible for restaurants to make that decision. There are restaurants who may not feel comfortable with the outdoor seating, the TOSAs that we've been discussing, and many of those restaurants have communicated with our department that they do plan to continue offering curbside takeaway, delivery services as well. And so I would still encourage all of our citizens to continue to support those restaurants, even if they are not participating in the TOSA program.
That's great. Thanks very much. All right, well, we are just a little past half past, and I think that now may be a good time to wrap it up. So thank you so much for taking the time to join us. And again, thank you for everything that you're doing to take responsibility to make sure that you are helping us make it through this shared crisis. It really does take all of us doing the right thing if we're going to keep trending in the right direction on each of these measures, particularly as we move into phase one. So what does doing the right thing mean? Continue to limit the trips that aren't needed. And if you're sick, you absolutely must stay home. Please use the strict physical distancing of 6 feet when you're around other people outside your household. Wear that cloth face covering. Every individual has to be part of the solution with masks whenever you're in public spaces, including in businesses. And wash your hands frequently. That's been true throughout, and it's true now. Cover your coughs and sneezes and clean and disinfect the surfaces that you, your loved ones, and your friends are touching. And while these practices are working, we're seeing them in the data. It's also true, and it's really important that we take a minute to recognize that a lot of our members of our community have become sick in Arlington. And in fact, 109 of our cherished family members, neighbors, and Arlington residents have lost their fight to this virus. So on Monday in Arlington, we will be joining other officials around the nation, as well as faith leaders, for a moment of silence, lowering our flags to half-mast to remember those 109 Arlington neighbors. We know that their memories are going to be held tight. They were an important part of our community. They mattered to their families, to their friends, to their loved ones, and to all of Arlington. So please join us in observing that moment and acknowledge those half-mast flags as we continue to keep up the fight against COVID-19. We have to remain vigilant to stop the spread and eventually have a full health and economic recovery. Thank you again for joining us. We will see you same time next week. Our colleagues Libby Garvey and Christian Dorsey will be here for more updates on COVID-19. As always, please visit arlingtonva.us/COVID-19 for more questions and answers. You can also call 703-228-7999. Thanks again. Have a great weekend, and we'll see you next week.